Hi, this is Dr. Bob Dannenhoffer, the Public Health Officer for Douglas County, with another of our Facebook Lives. It's November the 17th. I'm in the studio all by myself at this point, so I'm going to take my mask down so that those of you who read lips can better see what's going on. So again, Dr. Bob Dannenhoffer, and we're going to go through what we always do. We'll go through the world situation, the U.S. situation, the state situation, the local situation. And then I've got some great new information today, but really the purpose of this tonight is to answer your questions. So please go ahead and put those questions in the chat section, and we'll get to those, as many as we can tonight. We're going to stop by 7. We've had a lot of questions over the last few days. So in the world, still a very active pandemic, 60 million cases, 1.3 million deaths. We have now had case counts of over 500,000 for the last several days and over 10,000 deaths a day. So really a very active pandemic. Still very active in the U.S., India, Italy, U.K., Russia, and Brazil. However, over the last 3 or 4 weeks, I've said about the same cases, the U.S., Brazil, Europe, and whatever along the way. But I will tell you that over the last week or so, that has kind of changed. So that now the U.S. has as many cases a day as the next 9 countries combined. So think about that. So the next 9 countries behind us, with a combined population of 2 billion people, 2 billion people, have as many cases as the U.S. with a population of 330 million. So our case rate is really high and continuing to go up, whereas, some of the other countries, Germany's flattened the curve, France, actually they flattened the curve and got down. The Netherlands has nicely flattened the curve. And you remember about 6 weeks ago we talked about Israel, which had really a steep rise. They did a lockdown, a second lockdown, which was really hard for them. They did this lockdown and their cases have now decreased and stayed low. So it can be done. It can even be done in the winter time in temperate climates. And so the U.S. hasn't gotten there yet. We still continue to have more and more cases. We are now averaging over 150,000 cases a day. I mean, that is stunning, 158,000 cases a day. And whereas a few weeks ago the deaths were low, we're now averaging 1,100 deaths a day. And I did the calculations on this. And so the calculations are that the deaths follow the peak in cases by about 2 or 3 weeks. And the death rate per cases early on was 5 or 6%, went down to 2%, and now is about 1 point something percent. And when you look at that, it looks like we're going to be having 1,200 deaths a day every day between now and the end of the year. It's 50,000 more deaths by the end of the year. And so we really, if we can turn this around. We showed in Germany, we showed in France, we showed in Israel that we can turn this around with little actions. So in the USA, 11.7 million cases, 254,000 deaths, 36 states yesterday with over 1,000 cases. I mean, that is just so worrisome. In Oregon, we're at 58,000 cases, 778 deaths. We're averaging 900 cases a day. So, just a few weeks ago, we were averaging 300 or 400. Now it is at 900 cases a day. Deaths are still low in Oregon at about 5 per day, but the number of hospitalizations is sharply up. So in the first part of the pandemic, we had about 300 in the hospital a day. That went down to 100 or so, and now it's back over 300. And so the concern is that cases are followed by hospitalizations, which are followed by deaths, and that's the real concern we have. The hospitals in Portland are really struggling. I was on a phone call today with the people from OHSU, and they're starting to shut elective surgeries, having lots of trouble staffing, and so that is a problem. And they're beginning to see some areas where PPE is getting tight. Not shortages like we had before where you could never find it, but where things would be tight, things would be delayed in the schedule. And so starting last week, the governor put this freeze in effect, which takes effect tomorrow. So it really is, we are really trying to make a difference on this. And I think we can. In Douglas County, we're at 678 cases and 12 deaths. We have 199 people in isolation. We've had over 200 cases in the past 2 weeks. Remember, it took months to get to the first 100 cases, and now we had 200 cases in just 1 week. Really an astounding number of cases. We're having about 700 contacts out there. And it's really, really related to gatherings. So one of the big gatherings we had is in Reedsport, a Halloween party that led to 25 cases, affected 3 different counties, affected the high school, affected a bunch of businesses, affected city government, affected the harbor, affected the clinic. And so these decisions to have a party with 50 people have such wide rippling effects. And so later I'm going to make an ask of everybody here that we can go ahead and do it. So let me answer some questions. So Chelsea says, is there a chance of a full federal level shutdown? I think not. I think we're going to let states do what states are going to do. And I think we're going to let states do what states are going to do. I think Oregon has done a very logical thing. The governor was on NPR today. She was sounding great. So I would have you listen to that. I think it's going to be different by states. There are still some states that are really badly affected, South Dakota, North Dakota, who refuse to do anything. And then other states that are moderately affected, like Oregon and California and New York, that are doing increased restrictions. Again, when you look at the curves in Germany, France, and Israel, Netherlands and Israel, it's really striking that you can do stuff that's not draconian that will really decrease the number of cases. So how is it that Winston schools have the option to stay open when the case count is so high? Crystal asks. This is a good question. This is incredibly complicated that I'm not going to be able to explain on the air, but if you go to the Ready School Safe Learners, in the section on metrics, and then on the exception of the metrics, Winston schools and other schools that opened under the previous metrics are allowed to stay open until January 4th. Doesn't mean that's a good idea that they stay open until January 4th, but it means that they can stay open. Now, schools are very complicated, and school closures are incredibly complicated. What isn't complicated for me is making a limit on gatherings, making a limit on big gatherings in bars and restaurants. That is not at all controversial to me. There's great data that's where this is spreading. There's anecdotal data about where it's spreading. There's a recent article in Nature that tracked people who had COVID and people who didn't. People had it much more likely to go to big restaurants than others. So I think those things are all reasonable. I think the admonition to work from home if you can, I think all of those things are great. When you look at that, those are all much, 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 much more risky than school. In fact, at school, we've had a lot of cases at school, but in every case, we think the case was brought into the school rather than spread at the school. And schools do many good things. I mean, they teach students, kids get meals and other things there. So if you look at it from my point of view, I close down a lot of other things and restrict a lot of other things before I restrict schools. And so schools have the opportunity to stay open. Now, should schools stay open or close? That is clearly a school board decision. Again, we're the weatherman. We are predicting very stormy weather over the next few weeks. We're predicting incredibly stormy weather, but it is up to the school boards to decide if they want to stay open. So are the cases this week linked to workplaces or families and carelessness? So almost all of our cases this week are related to gatherings, and then they spread in the workplaces. So for example, we have one here where there's a gathering and they go to work and then they spread it to other people at work. But it's almost always family gatherings or out-of-state travel that is the inciting episode. Debbie said, what is the first typical COVID symptom? That is a tough one. So I've done a few interviews this week, and one guy, healthy young guy, says, I felt fine. And then Friday afternoon, it was like I got hit by a bus. I was achy and tired, and everything felt terrible. Didn't have much fever until a few days later. Didn't have much cough until a few days later. Other people first notice upper respiratory symptoms. Other people first notice a cough. So it can vary, but I think that overwhelming fatigue is actually not uncommon when we talk to people that like, what happened to me? I feel so tired, or the cough, or the fever. Now, some people never have any symptoms. Some people just have diarrhea, But I think that dragging fatigue is really an interesting one. Now, interestingly, the most specific sign of COVID is loss of sense of smell or taste, but most people don't get that until a few days in. So Kelly says, for people that have had COVID and recovered, do they have different expectations once they're done with quarantine? No. So people who actually have COVID are in isolation, and when they recover, no extra expectations. Although when we get a little break today, we'll talk about an incredibly interesting study from Michigan about long haulers. So Nael says, would you welcome a federal response to any kind of unity? So I think what we would want is for people to stop fighting about stuff that really don't need to fight about. I mean, you don't need to push people over in the store if they wear a mask or don't wear a mask, but we should all wear a mask. You don't need to go ahead and argue about, who gets credit for having the vaccine. Let's just be happy that we may get a vaccine. So what are all the other countries doing to flatten the curve that the U.S. is not doing, Crystal asks. Well, I don't know all of the other countries, but I will tell you that Germany, France, and the Netherlands instituted almost exactly the restrictions that the freeze is. Work from home, closing down bars and restaurants, different in different countries, but closing down bars and restaurants, asking people to wear face masks and have small gatherings. So nothing rocket science, nothing that they figured out that we didn't, all just the same. Now, other countries in their lockdown were much stricter. So Israel was much stricter about staying in the house. We do not have a stay-at-home order in Oregon, but we have a don't eat in restaurants. We have a work from home. We have a limit gatherings kind of thing. Christine asked, even though a vaccine is coming out sooner rather than later, will we see an immediate response with decreasing cases, or will it take a few months to see the decrease? Christine asks. That is a great question, and depends upon the timing that the vaccine gets here. So the timing of the vaccine getting here is, I expect, and let's take Douglas County. We have a little over 100,000 people in Douglas County. To get us to be to the point where we have enough people immune, we're going to need to get about 60 or 70,000 people immune. To get 60 or 70,000 people immune, that means that 70 or 80,000 people need the vaccine. So the best I heard is that we're going to have 4,000 doses in Douglas County by the end of the year. So the best would be 4,000 doses by the end of the year. And then after that, an additional 4,000 doses a month. Now, there may be other vaccines get approved. If more get approved, it may be sooner. But let's say it's 4,000 a month, which would actually be, if I could get that, would be pretty great. But if it was 4,000 a month, and we have to get to 60 or 70,000 people getting the vaccine, that's 15 months. Now, if it doubles up, and it could double up where we get even 10,000 a month, that's still going to take till the summer of 2021. So I really believe the summer of 2021 is where we're going to see enough people immunized that the disease will get down to where we're having days with no cases. Now, it doesn't mean it won't happen all of a sudden, but typically when a disease builds up immunity in the community, it goes down slowly. Now, it'll go down quicker if people avoid gatherings, if they wear face masks, if they socially distance, it'll even be better. So Kathy says, how is the hospital handling the overload of COVID patients, or are they at full capacity? Well, let me tell you, the story is that even on a regular day, even before we had COVID, hospitals run high levels of fullness. So, hospitals are not having half-empty beds just waiting in case somebody gets sick. Most hospitals are pretty full, even on a regular day. So the hospitals have other things in them. People with needed surgery, people have their appendix out, people having babies, people get heart attacks and other kinds of things. The hospital is doing a good job. Now, we were very concerned towards the end of last week when we were at 20 hospitalizations, and it was rising. We're down a little bit today. Many of those people got moved out of the ICU. So it's a little lighter today, but still, this is a problem. The hospital has a great plan for doing more and more cases, but as they do more and more COVID cases, they can do less and less of other things, and we don't want to do there. So Kelly says, well, people who have had COVID need to get the vaccine? Don't know. That's one of the questions that we do not know. We also do not know about what ages or who will get the vaccine first. Now, who will get the vaccine first? So it's probably going to be healthcare people, and if it works in seniors, and we don't know yet if it works in seniors, would be people in nursing homes. Now, many vaccines work best in young people, don't work as well in seniors. They've only had in each of these things less than 100 people with the disease. So with less than 100 people with the disease, the age breakdowns, like how well it works in 30-year-olds, 40-year-olds, 50-year-olds, 60-year-olds, is really hard to tell. And so I don't think we're going to know right off how well it works in seniors. It might work great in seniors. It might not work as well in seniors. It's just really hard to tell. So Beth says, I read an article that even with a vaccine, we'll still need to wear a mask and socially distance. If that is true, why do we need the vaccine? I think what they're saying is that until we have enough herd immunity, until we can get our rate down to, just a few cases a day, we're going to need to do more than just the vaccine. We're also going to do the face mask. So Dr. Redfield had said, well, right now the face mask is better than the vaccine, and he's right, that until the vaccine gets here, this is probably the best we can do. So when we look to when we look to get rid of a disease, what we need to do is we need to decrease the reproductive number from what it is to less than 1. So the reproductive numbers for everybody who has the disease, how many do they give it to? Now, many diseases it's around 1, which means the disease doesn't exactly go away, but it never really spreads. So the R with strep throat is about 1, which means we're never rid of strep throat, but it doesn't ever spread in huge epidemics. This has a reproductive number of about 4. So on average, every one person who has this gives it to 4, but it's confusing because there are a lot of people who don't give it to anybody. And then some people give it to a lot of people, like in this Halloween party at the coast, where they give it to 25. One person, we think, gave it to 25 people. And so as long as we have those spreader events and those super spreader events, we're going to need a lot of immunity there to keep that from spreading. So my answer is that we probably do need to use a face mask and social distancing until the level of vaccination is high enough to keep this down. And again, I don't think that's going to be before summer of next year, but hopefully summer of next year. So can I offer any data insight into the logic of taking restaurants back to takeout only when it's clear that most of the transmission is coming from personal activities like social gatherings? Is there data suggesting restaurants are part of the problem? There is some data suggesting that many of these social gatherings happen at restaurants. So, when we talk about small social gatherings, it's small social gatherings at restaurants. And so I've been to a few restaurants where I sit by myself in the corner, and when I sit by myself in the corner, I think that is very safe. However, I've been at those places where there's tables of 10 or 12 all over each other, and it's that kind of social gatherings that happen both in private homes, in clubs, or in restaurants that really is spreading it. So that, I believe, was the issue with restaurants. Now, there would be a way, I think, to let restaurants come back and have tables of no more than 6. I think for most restaurants that would be okay. That would give them the bulk of their stuff. And that may be what we're seeing. But again, it's social gatherings, and these social gatherings have happened at all those different places. So what are some things that caregivers should be aware of when caring for a COVID-confirmed patient, and what precautions should we take? Well, people with COVID are generally contagious from 10 days from the beginning of the symptoms. So symptoms plus 10 days, probably the most contagious in the first few days. And we don't want you to get it either, because obviously now if the caregiver gets it, then that just keeps the thread going. So we would recommend that if you're taking care of a COVID-confirmed patient, that you use the highest quality mask you can get, which would not be this, but like an N95 mask, that you should wear eye protection. There's actually increasing data that eye protection is important. And then we would also recommend that when you're in areas where you might be around their secretions, that you wear gowns and a glove. And be cautious, because at least in other kinds of places, in early on, there were a lot of spread among families who were caring for COVID-confirmed patients. So Kat says, a great question, is there a simple way to determine whether the vaccination has worked? Is there an immune response in blood work? Well, you could look to see if you had antibodies, and again, there's so few cases in this that they've looked at antibody tests in there, and they'll see if antibodies are predictive. But the Pfizer vaccine was said to be 90% effective, and the Moderna vaccine 94% effective. So that's pretty darn effective. Generally, with other vaccines, if you generate a good immune response, you will be immune. But we don't know that yet with this one. So Tracy says, is there data on contact tracing transmission, such as family gatherings, grocery stores, work, etc.? Not so much in this country. And not so much in this country because people have objected to the government tracking your phone. But in other countries where the government tracks your phone and everybody's sort of kind of expected to have a phone and carry it with them, what you can do is you can actually do the tracing where you look to see where people likely got this. There's a plan in Oregon and Washington to try it out for people who are willing, but it's not gotten very far. But imagine the situation where you had in Israel or in Korea where you have a lot of cameras and everybody's got a phone and they can track the phone. So they see that now Johnny is positive for COVID. They track Johnny's movements, and then they find everybody that Johnny was within 6 feet for 15 minutes of, and then they contact them and they see who Johnny infected. That pretty amazing, right? I think that people would consider that a huge infringement on our liberties if the government knew within a few feet of where you were at every moment of your life. But with that, what they've seen is that gatherings at restaurants very clearly are a spread. What they've seen in that is that momentary gatherings like going to the grocery store, not a big risk. What they've seen is that gyms do seem to be a big risk. It's a little hard to tell, right? Because you don't always know who's with you in the gym. But gyms did seem to be a risk. Salons did not seem to be a risk if people were wearing face coverings. And that's why this freeze is different from the original one, because it works on that data. It also shows that schools are not a place of a lot of spread. And that's why with this one, they're cutting the places that do seem to have the biggest spread: family gatherings, social gatherings, either at home or in restaurants, bars, very clearly a place where there is spread, and gyms, but not salons where there doesn't seem to be a lot, not grocery stores where there doesn't seem to be a lot of people wear face masks. At work is very interesting. When we see spread at work, there is occasionally spread between workers and their clients, or workers and patients, or patients and workers. Occasionally you see that, but the biggest spread at workplaces is among workers on break. So I did an investigation yesterday, and the answer is, well, tell me about that. Well, we do a very good job when we're at work. We're always wearing masks and social distancing, but then we sit around and have lunch every day. Well, it's the sitting around and have lunch every day that spreads it at work. It's not the, wearing a mask while you're changing somebody's oil. It is the, in between, either going out for a smoke break or a work break, where you're sitting right next to each other. And not surprisingly, you probably have your mask down. You're probably eating or drinking. You're probably telling funny stories. And that's where it spreads. So again, telecommuting, working from home, what that does is you don't have the break time with your mates. And that's why this was really a very targeted freeze. I don't think that's gotten played up enough, but it was targeted, and it was targeted because it really focused on what we know where it spreads. And that's why schools were not part of it, because although there are a lot of cases in schools, remember I said they almost always come into the schools, and we've not seen a convincing story of spread at schools. What we have seen is that it does spread among teachers, but it doesn't spread among teachers in the classroom. It spreads among teachers in the teacher's lounge. So we have to worry about it. So Debbie says, have I heard about the potential nose spray that blocks COVID from attaching to cells for 24 hours? Yes. So the story is it attaches to the nose cells using something called the ACE2, the angiotensin converting enzyme 2 system. And yes, you could block that. If you block that site, you might be able to block it. It's sort of exciting. But, I've heard about this since April, and I don't think it's made that much progress. It is not yet in phase 3 trials. But yeah, that would be pretty smart. You find something that attaches to the ACE2 inhibitors, you cover them up, so that now the virus can't get in. That would be great. The problem with ACE2 ACE2 receptors is there are a lot of different places, so you need to use more than nose spray because it's also in the gut, it's also in the mouth, it's also in the eyes. So, keep sending more questions. I'm going to go through some things. So, we have talked about our Doppelganger counties. These are other counties in 3 other states that have taken a different approach than Oregon. And they're similar size, similar composition, similar ages, similar economies and whatever. Not exactly the same. If they were exactly the same, I'd call them identical twins. But doppelgangers are places that look pretty much alike. And so we picked Douglas County, and we're struggling, I think. But we have about 18 cases a day, and we have had 12 deaths. And I can tell you that 18 cases a day and the 12 deaths, this is making me pretty sad. And the 18 deaths a day is really kind of overwhelming us. But when I look at the other places, Twin Falls, actually smaller than we are, they're having 113 cases per day. Remember, we're having 18. They're having 113 cases a day, and they've had 68 deaths, so 5 times many deaths. Pennington, which is where Rapid City is, are having 153 cases a day, and they've had 59 deaths. Lowndes County is not having as many cases at 33 a day, still about twice ours, and they've had 122 deaths, 10 times many deaths. So 4 similar counties, although we feel like, oh my God, how could you do any more than we're doing now? These places are having 5 or 10 times as much disease and 5 or 10 times as many deaths. I really wouldn't want to be the public health official there. The other thing is, a great article came out from the Annals of Internal Medicine. So Annals of Internal Medicine, a very well-respected journal. They looked at patients in 38 hospitals in Michigan. So Michigan had a bad time of this back in the springtime. And so they looked at these 1,648 patients who were discharged from the hospital in Michigan from March 16th to July 1st. So of those 1,648, about a quarter died in hospitals. So that's one way to get discharged from the hospitals, to die. So about a quarter died. Now, the death rate for hospitalized patients has come down since then, but that's about what it was back then. Of those, about 10% had to go to rehab. They were weak enough that they had to go to rehab. And then after 2 months, so after 60 days, an additional 84 had died. So these were people who left the hospital weak and debilitated and then died in the next 2 months. 15% of the people who got discharged got rehospitalized. We've seen the same thing. We have a number of rehospitalizations. So we have a number of people getting better. They go home. They really can't make it home, have to come back and be that. Of that, they were able to talk to about 500 people. That's a lot. So they talked to 500 people 2 months after they were discharged and say, hey, how you doing? Well, about a third still had cough and shortness of breath. And 92 were actually worse than they were in the hospital. And this is one of the weirdest things of people who have mild respiratory symptoms in the beginning, and then weeks and months later, as they're recovering, they actually now have worse cough and worse shortness of breath. That's so weird. I can't ever imagine hearing that with any other disease. About 65 out of the 500 had a decreased sense of smell or taste 2 months later. And we have a number of people who still, months and months later, still haven't gotten it back. And less than half of the people who were working before were able to return to full-time work. So fully half of the people were disabled enough that they couldn't return to full-time work at 2 months. That's a lot. When you think of heart attacks, most people can go back to work a few weeks after a heart attack, hernia surgery, whatever. Some people are going back the next day. But for half not to be able to work 2 months later was pretty stunning. About half had significant mental health issues, either severe anxiety that this could come back, depression because they'd been so sick, post-traumatic stress because they'd been in the hospital many times all by themselves without anybody else around them. And some had survivor's guilt, right? So many of these people were in families where multiple people were infected, and these were survivors that they talked to, so they survived, but their spouses died. And so significant mental health issues. And many had really severe financial impact. So really good article, very easily readable. So some of these articles you read is like, I can read the first 2 sentences and then I can't get past that. But this was great. It's in the Annals of Internal Medicine from last week. So that's a good one. All right, so Alexis says, I see people touching the front of their masks. Is that a good practice? No, you really shouldn't. You really should do that. But unfortunately with masks, people who are not used to wearing masks do touch their face and mouth a lot. And that was one of the original concerns about using masks. Now the good news is that this is a pretty puny virus once it lands on surface. So, there's some viruses like RSV where it lands on surface, you pick it up, you can give it to yourself again. This one, not so much. And so while it's certainly not a good practice to touch your mask, it is not as horrible as it is with other things. All right, a couple of other things. So great news on the vaccine. Fabulous news on the vaccines. The Pfizer vaccine and the Moderna vaccine, both of which are messenger RNA vaccines. Results are in. Now, what they did on these, remember they have a control group and they have a vaccine group. They wait until people get sick, and when a predetermined number of people get sick, they open the envelopes and they say who got the vaccine and who didn't. The numbers were something like on the Moderna vaccine, after 95 cases, they opened the envelope and 90 of the people who had the disease got the placebo, and only 5% of the people got the disease had the vaccine. That's where that 95% comes in. Similarly with the Pfizer vaccine, and that's great. Now, people have wondered a little bit about, hey, this timing is a little funny, coming in right after the presidential election, but it seems like you had to wait until you had 95 cases, and the 95 cases could have come in at any time. They happened to come in when they did. But these vaccines look great. Now, the Pfizer vaccine requires ultra-cold storage, although we're working through those issues. The Moderna, less cold, but not quite so cold storage. So we are ready, we are getting ready, all set to go ahead and start distributing this vaccine as soon as it's available. Again, we think we're going to get not that many doses before the new year, but we're ready to go ahead and get it done. Okay, so as a family member with COVID in the house, is there benefit to use Flonase or other nasal spray or zinc lozenges? We do not know. I have not seen any good studies that any of those things work. Now, I don't think any of those things are dangerous. So if you want to try nasal spray or Flonase or zinc lozenges, I think that's perfectly fine. But I don't think that there's any issue here. So Tracy says, are the updates available on YouTube? So if you're talking about these updates, the answer is they're available on Facebook, and somebody can tell me. I think they're also available on YouTube. I've seen them a couple of times on YouTube, so I've got my family members. Oh, but I saw you did this. So it's kind of a funny thing. Well, one of the things that we did see was that somebody has written in that DPHN does not follow the CDC guidelines for testing. And I don't know where they got that from, but we follow both the CDC and the OHA guidelines on testing. There was a time during the summer where the CDC was confused about whether you should test asymptomatic contacts Oregon at that time was testing asymptomatic contacts. So at that time, we continued with the Oregon thing. And now the Oregon stuff and the CDC stuff are about the same. Well, somebody has misinterpreted this to suggest that we have not suggested testing for asymptomatic contacts. Well, this is what's been on our website for a while. And so I'll read it to you. So if you're currently sick with COVID-like symptoms, cough, shortness, breath, diarrhea, nausea, loss of smell or taste, muscle aches, runny nose, that yes, you should get tested as soon as possible. These are symptomatic people. This is, I am not sick, but have been in contact with somebody who's positive for COVID. What we recommend is that you wait 5 or 8 days after your last exposure. If, for example, you go to a party, person is positive, you find out the next day they were positive, it's like, oh my God, I want to get tested today. You certainly can get tested today, but it's not going to, it won't be positive from your exposure yesterday. It takes 5 to 8 days after exposure for the test to become positive. So yes, you can get tested today, but then you also need to get tested in 5 or 8 days. So we say, if you're asymptomatic contact, wait 5 to 8 days and then get tested. So that's what we say. I don't think we've ever said anything different. So Mike especially, who thinks we did, I don't know where you got that from. And then the third one is, I'm not sick, but I have been in contact with somebody who's been in contact with somebody who's positive. So you're not a close contact, you're a distant contact, or you're not in contact at all of somebody. In that case, both the Oregon and the CDC guidance is that testing is not recommended. Now, if you want to get testing, we test anybody who wants to get tested at our Tuesdays and Fridays. So if you want to get tested at our Tuesdays and Fridays, get tested. And we have a lot of people who just want to know for some reason. They may have had what they thought was a contact and they're worried. You know what? So, I've done pediatrics for a long time. And, people come in and they say, Doc, I know this is crazy, but my kid has a headache and I'm just worried they have a brain tumor because, I had a friend in college who had a headache and then they had a brain tumor. And so I'm laying there at night, staring at the ceiling, worried that my little guy's got brain tumor. I mean, that's a terrible worry, right? And they say, let's just do a CAT scan. Let's just do a CAT scan. And if the CAT scan is normal, then you're good. Then you can sleep. And if there's a problem, we'll deal with it. And so the CAT scan, most kids with headaches don't have brain tumors, but if you have that in your head that you think they have a brain tumor, it's really, 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 really hard to sleep with that. And so what we're suggesting is, if you want to get a test, asymptomatic and not a contact, you shouldn't. So let me go through it again. If you're symptomatic, you should get tested right away with any available test. We usually recommend the rapid test because they're more rapid. If you're not sick but are a contact, we would recommend that you wait 5 to 8 days after the exposure and then get tested. And generally in those cases, the best test to use is a PCR test. And if you're not sick and haven't been in contact with a close case, but maybe in contact with a contact of a contact or a contact of a contact of a contact, then the recommendation is that you not get tested. But if you want to get tested, come by and see us on Tuesdays and Fridays and we'll do it. So hopefully that clears up any confusion that we're somehow not recommending testing of asymptomatic contacts. All right, so Deborah says, can you say again which vaccine is not a live virus? So the 2 vaccines that got approved are mRNA viruses. So they have genetic material in them, but they are not live. So live means could live on its own or could live in a cell. They can't live anywhere. The 2 other vaccines that are out there, the AstraZeneca and the Johnson & Johnson, a little more complicated. They do have live viruses, but not live coronavirus. They have live adenoviruses. It's a little confusing. So Colton says, have you heard about using mouthwash as a way to prevent COVID? Absolutely. I've heard all kinds of stuff. Using mouthwash, using a hairdryer in your mouth or nose, gargling with salt water. All of those things are perfectly fine to do. Mouthwash, all those things are fine. Will it stop COVID? Unfortunately not. Because if it could stop COVID, that would be great. I mean, that would be fabulous if it could stop COVID. It can't. So one of the big ones was, well, breathe in some superheated air because you only have to get to 77 degrees to kill this. Well, you have to get to 77 degrees Celsius to kill this, which is about 160 degrees, which would burn your airways. Ashley says, can people still get the antibody test? Yes. Anybody who wants to get the antibody test can get one. Simple blood test. They're much better now when they first came out. When they first came out, there were a lot of little small makers out there that had really crummy little tests, and nobody should have had one of those. But the good test, Quest, Mayo Clinic, LabCorp, whatever, perfectly logical. And if you want to get one of those, please do. So when should you get tested if you're living with someone who has COVID and then completed isolation? 5 to 8 days. So 5 to 8 days after your exposure. So, depending on when your exposure would be, so 5 to 8 days after exposure. So about a week or so after exposure is great. And again, the best test to do is the PCR test that we're doing at the fairgrounds. So my daughter was exposed on Monday. Should she be tested on Friday? Friday is a little early, right? So when you look at the way this disease works, the highest rate of getting a positive is 5 to 10 days after exposure. So Friday is a little early. So I'd get her tested next Tuesday. And so again, we're doing them Tuesdays and Fridays. So next Tuesday would be the optimal time for that person to get tested. Okay. So let me tell you about something else. So I saw a friend today, and she got Invisalign. And, she said, you can do anything for a year. She'd either feel funny in the mouth, whatever. I can do anything for a year. And that led me to thinking, there's just less than 40 days between now and Christmas. And I think if the pattern goes in the way it's going now, or the way it's going in Wisconsin or in the Dakotas and whatever, there's going to be a really, really nasty time over the next 4 months with high hospitalizations, high case rates, many deaths. There is light at the end of this tunnel here, and the light at the end of this tunnel is that the vaccines are going to be there. The other light at the end of the tunnel is it's going to become springtime. In springtime, I guarantee you that. And when it gets there, I think cases may decrease a bit with that springtime there. So what we're saying is you don't have to live with these restrictions forever. I really think in 6 months, which is May, that things are going to look much brighter. We're going to have many more people vaccinated. We're going to immunize. We're going to have other kinds of things happening. We're going to have probably better diagnostics and better therapeutics at the time. So I really, really, really think that things will be better till in May. So we're not saying that you've got to do these things with teleworking and wearing masks and social distancing forever, but at least until May we need to do it. And so, as a Catholic, we had Lent, and Lent was, 40 days of reflection and 40 days of some self-denial. And if we as a Douglas County, and I'm not asking people other places to do that, could really between now and Christmas really buckle down, we could actually bring the case rate down, and that would be the best Christmas present we could give to our seniors. Because when I look at the people who get sick as seniors, in many cases in our nursing homes, it's not the nursing home people that were out dancing who got this, who brought this back. It's typically workers, and typically low-wage workers who sometimes are working extra jobs, sometimes living in crowded situations with 3 or 4 roommates, who get this and then bring it to the nursing home and bring it to others. And they get this because there's a lot of disease in the community. So if we could bring the rate of disease down in the community, the Christmas present would be that none of our seniors in the nursing homes are infected. Oh my goodness, how great would that be that none of those seniors are infected? And if none of those seniors are infected, then we would get this. So it's really about just bringing this down over 40 days. And we see in Germany, we see in France, we see in the Netherlands, we see in Israel, all countries that are really amazingly like us, that you can do it. And you can do it without cratering your economy. So I'm asking people to really pay attention to that, especially the gatherings. And that brings me to Thanksgiving. So Thanksgiving is coming up. Let me answer a few more questions. We'll get back to Turkey Day. Jenny says, I also heard that when someone has COVID, they can't get it again for another 90 days. Is that true? If they can't get infected again, could they pass it on? So we don't think you're going to get it again within 90 days. So all of those cases where people got it and then got it again, it was more than 90 days. And there's pretty good data that for at least 90 days, you're going to have enough immune resistance to that. So I won't say they can't, but it's very unlikely they'll get it for another 90. They will get it in the next 90 days. And that if you don't get infected, you can't pass it on. So actually, you'll remember during the really terrible days of the pandemic here, one of the strategies was to have infected healthcare workers who got infected and were over this working in COVID units, because presumably they wouldn't get infected. So in the old days, before we had medicines, vaccines, and whatever, that's sort of what would happen. They knew that somebody who was recovering from smallpox wouldn't get smallpox again. And so that the people who would care for the people with smallpox would be the people who were recovering from smallpox. Also, similarly with Ebola, is that during the terrible Ebola times before we had reasonable treatment or vaccine for that, what happened is that in the communities, people who'd recovered from COVID would be the ones who would bury the dead, because that would be the highest risk activity. So yes, we think that's true, that once you've had COVID for the next 90 days, you're likely not to get it again and likely not to pass it. Okay, so let's get back to Turkey Day. So Thanksgiving is coming up, one of our favorite holidays in our family, big gatherings, usually all the Oregon people get together, sometimes friends, sometimes other people we invite in. And so it was not uncommon on Thanksgiving for us to have 30 or so people around the house, several turkeys and hams and dozens of pies. Really one of the great days, because these are times when you get to see people that I otherwise wouldn't get to see in the year. And this would be a time that you'd have some discussions, hopefully not too much about politics, but you'd have discussions about how everybody was doing. So truly a great and memorable time. However, in this year, having that party of 30 could be safe, right? It could be that none of those 30 people had it. But it could easily be that one of the people was brewing the disease. They weren't yet sick, and now 15 of those 30 would get sick. The problem would be, of those 15 of those 30, some would be workers, and they would go to work and they'd spread it to the hospital, or they'd spread it to the clinic, or they'd spread it to another family member because they didn't know they were having it yet. And that one little Thanksgiving dinner could lead to 15 initial cases and 20 or 30 or 40 subsequent cases, some of whom might be old people. Some of those may be people who get sick or die. So, for example, at this Halloween party that I talked to the coast, they've had 2 hospitalizations. They may have a death. I mean, it's the kind of thing that is just really scary when you look at what starts to seem like a benign activity, like let's have a little Halloween party, and how it spreads. So the governor's recommendation is that you have Thanksgiving with your own family. Now, when we get to next May or June and this is starting to be in the rearview mirror, we should party like crazy, because we should party that we've gotten through this. But at least for now, at least for the next 40 days, I'm asking people to do this. You can do almost anything for 40 days. And so for 40 days, I'm going to just be in my household. I'm not going to have lots of other contacts. We're not going to have a big Thanksgiving dinner, as much as I love all the pies that you can eat. I'm not going to go ahead and travel as I normally would during that time. This is a time we're going to stay home and concentrate on bringing the case count down, because as was shown in these other countries, within 40 days, we could bring the case count down, probably not to 0, right? We're not going to get it down to really low numbers until we have a vaccine. But we could bring it down, instead of the 18 cases a day that we're averaging now, we could bring it down to 3 or 4 cases a day. And at 3 or 4 cases a day, schools could then reopen in the new year much more safely. The nursing homes would have far fewer outbreaks than they have now, and we then could relax on businesses. Now, I wouldn't go back to willy-nilly do whatever you want, but if you said to restaurants, yeah, open up, but please don't have tables of more than 4. If you said, you could open up gyms, but please be careful about distancing, you could open up other things, and that would be my hope. My concern is that people are going to continue to do things just like they've done before and spread it and whatever. We're going to continue to have 12 or 15 cases a day. And so we're not going to get any benefit from the many people who are doing this. We really need to do this together as a community. And I know that's been politicized, but please let's not make it political. Please make it, we're doing this to protect grandma. We're doing this to protect our friends and relatives. And we're doing this to protect those seniors who are very vulnerable, who are in nursing homes. All right. It looks like that's the end of our questions. This was great. If people have other questions, you can send it to us at Facebook Questions at DouglasPublicHealthNetwork.org. That's Facebook Questions at DouglasPublicHealthNetwork.org. And again, I just want people to be safe and be kind. There have been people who have been incredibly kind to me in this last week, telling funny stories about. You may have seen this little video we did with outtakes, some of which are quite ridiculous, as the sign kept falling off the wall here, that were really quite ridiculous, but, been very kind with that. We've had a couple of people be not quite so kind, and the answer is, during this time, it is a tough time. People will disagree about whether schools should be open or closed. People will disagree about whether restaurants are a key driving factor. The answer is, I really think the people who are working on this are doing their very, very best to make it better. So I'm just asking, be safe and be kind. Thank you.